Welcome to the deep dive. Today, we're diving into the world of dentistry.
Ooh, dentistry.
But not just the, drills and fillings kind of stuff. We're going way deeper.
Okay.
Like into the ethics and the legal stuff that shape the whole profession.
Interesting.
You guys give us some really fascinating material to work with.
Okay.
Stuff about the American Dental Association, the Dental Assisting National Board.
Right.
Even this concept of respondent superior.
Sound like you want to get into like the rules of dentistry.
Exactly.
Not just like what happens when you're in the chair,
Yeah.
but like the whole system around it.
Yeah, like are there rules about who can do what in your mouth?
Yeah, that's a great question.
Whether you're a patient or thinking about, going into dentistry or just curious about it all,
Sure.
this deep dive should give you some insights.
It really should.
It's more complicated than you might think.
Oh, yeah.
It's crazy how important the idea of consent is in dentistry,
Oh, for sure.
like legally and ethically.
Right. It's huge. So let's start with the ethics part.
Okay.
I mean, we all have a sense of right and wrong, I guess.
Yeah.
But what does it actually mean to be ethical as a dentist?
Well, you're dealing with people's health and appearance,
Right.
sometimes even their self-esteem.
Yeah.
It's personal, right? So there's a lot of trust there.
Right.
So ethics in dentistry is about making sure every decision, every procedure puts the patient's well-being first.
So it's not just about not getting sued.
Right.
It's about a deeper responsibility.
Exactly.
Okay, so you've got these codes of ethics from groups like the ADA.
Yeah, the American Dental Association.
Laying out the values and principles.
Exactly.
So these codes are like a moral compass
I like that. Yeah.
for the whole dental team.
The whole team.
But how does that affect me, the patient?
Well, it's all about protecting you.
Okay.
These codes make sure that your dentist is committed to those high standards,
Okay.
that they're making decisions that are good for your health.
Not just what's convenient or, profitable for them. It's
Yeah.
about you.
That makes sense. And it's good to know those safeguards are there.
For sure.
But let's switch gears
Okay.
to the legal stuff.
Okay.
You mentioned the State Dental Practice Act.
Yes.
What's that all about?
That's where the real rules are.
Okay.
It's a set of laws specific to each state
Okay.
that regulates everything about how dentistry is practiced.
So it's like the rule book.
Yes, exactly.
What kind of stuff does it cover?
All kinds of stuff.
Okay.
Making sure dentists are licensed and have the right qualifications.
Makes sense.
Even things like how dentists can delegate tasks to their staff.
Hold on. Delegate tasks.
Yeah.
So it's not always the dentist doing everything in my mouth.
Not necessarily, no.
Okay.
Dentists work with dental assistants and hygienists.
Right.
They're a vital part of the team.
Okay.
But the State Dental Practice Act is very specific about what each person is allowed to do.
Wow.
And what level of supervision is needed from the dentist.
That's interesting. So there's like a whole chain of command in the dental office.
It is about safety.
Okay.
The Act outlines different levels of supervision.
So-
Direct supervision,
Where the dentist is right there.
right there in the room.
Okay.
And general supervision,
Okay.
where the dentist doesn't have to be there,
Wow.
but they have authorized the procedure.
So even if it's the hygienist cleaning my teeth,
Right.
there are still legal guidelines
Absolutely.
making sure I'm getting quality care.
Yes. Every state has its own rules, but the idea is to balance the expertise of the dentist with the skills of the dental team and always putting the patient first.
Wow, it's complicated.
It is.
Ethical codes, legal acts, different levels of supervision.
It's a lot.
Before we get into the specifics of all that,
Okay.
let's talk about who's actually on the dental team.
Yeah.
You mentioned dental assistants.
Yes.
What do they actually do?
They really are the unsung heroes.
Okay.
They do everything from prepping patients and instruments to taking x-rays, giving post-op instructions.
Wow.
It's a demanding job.
Sounds like it.
Requires a lot of different skills.
Are there different kinds of dental assistants?
There are.
You mentioned CDAs and RDAs.
You're right.
What are those?
CDA stands for Certified Dental Assistant.
Okay.
It's a nationally recognized certification.
Okay.
You have to pass a really tough exam,
Oh, wow.
which shows a lot of competency.
So if I see CDA by someone's name,
Yes.
they've gone the extra mile.
Exactly.
Okay, what about RDA?
Registered Dental Assistant.
Okay.
That one's state-specific.
Okay.
Often allows assistants to do more advanced procedures.
Okay, so there's a difference between national and state.
Exactly.
It seems like a lot to become a dental assistant,
There is.
but I guess it's a serious job.
It is.
A lot of responsibility.
A lot of responsibility.
Okay, so we've got the ethics, the laws, the different roles.
Mhm.
Speaking of risks,
Okay.
malpractice lawsuits are a big deal for dentists.
They are.
What can they do to minimize those risks?
Risk management is critical.
Oh, yeah.
One of the biggest things is meticulous record keeping.
Okay.
Everything that happens during a patient's visit has to be documented.
So like a detailed log.
Exactly.
Okay.
Protects both the patient and the dental team.
Okay.
Prevents misunderstandings.
Right.
Ensures continuity of care.
Okay.
And it's crucial evidence if there's ever a legal issue.
So documentation is key.
It really is.
What about informed consent?
Oh, that's crucial too.
Yeah, we talked about it earlier.
It's not just about getting a signature.
Right.
It's about making sure the patient really understands the treatment, the risks, the benefits, the alternatives.
So making sure the patient is informed and making their own decision.
Exactly. It's about respecting them and making them part of the process.
Okay.
And there are different kinds of consent.
Oh, really?
The best kind is informed consent,
Okay.
where the patient gets a clear written explanation and they can ask questions
Before anything happens.
before anything happens.
That seemed like the best way.
It is.
What about other kinds of consent?
Well, there's implied consent,
Okay.
where you kind of assume consent based on the patient's actions.
Like what?
Like if they sit in the chair and open their mouth.
Yeah.
But that can be tricky.
Right. It's not as clear.
Exactly.
So relying on implied consent could get a dentist in trouble.
It could.
So informed consent is always the best.
Always.
What happens if a dentist treats a patient with no consent at all?
That's where things get really complicated.
How so?
Even if a dentist thinks they're doing what's best for the patient,
Okay.
treating them without consent, implied or informed, could be considered battery.
Wow. I had no idea.
It's serious.
It really shows how important communication is.
Yes.
Making sure the patient understands what's happening.
All the way through.
This is making me think about that respondent superior thing.
Oh, yes.
Let the master answer.
Right? Exactly.
How does that work in dentistry?
It means the dentist is responsible for what their employees do, as long as they were following the dentist's instructions.
So even if a dental assistant makes a mistake,
Right.
the dentist is still responsible.
In most cases, yes.
Wow.
It really emphasizes that the dentist needs to train their staff well,
Right.
communicate clearly, and supervise everything.
Okay, I see. That's a lot of pressure.
It is.
But I guess it makes sense.
It does.
They're the ones with the training and the license.
Exactly.
So they have to make sure it's all done right.
Yeah, it's like the captain of a ship.
Okay.
They're responsible for what happens,
Right.
even if they're not the one steering.
I like that analogy.
It works.
This is all so interesting.
It is.
Ethical codes, the legal stuff, the different roles on the team.
Yeah.
Dentistry is more than just drills and fillings.
Way more.
It's a whole system.
The whole system.
Speaking of ethics,
Yeah.
what are some of the tough decisions that dentists have to make?
Well, let's think about patient confidentiality. They have access to a lot of personal information.
Right.
Health lifestyles, even personal struggles. Yeah. And they have to keep it all private.
That's a big responsibility.
It is.
And what about conflicts of interest?
Oh, that's another one.
How so?
They have to make a living, right?
Right, they're running a business.
Yeah, exactly.
But they can't just recommend treatments to make more money.
No. They have to do what's best for the patient.
So it's a tough balance,
It is.
being a healthcare provider and a business owner.
It's a tough one.
What if a patient wants a treatment that the dentist doesn't think is right?
That happens too.
Like for cosmetic reasons.
Exactly.
That seems like a really tough spot.
It is.
There's no easy answer.
Not always.
That's where those ethical codes come in.
They provide a framework for
Okay.
making those difficult decisions.
So it's like a roadmap
Exactly.
to those tricky situations.
Right.
But why is all this important for someone who's not a dentist?
It's about being an informed patient, understanding your rights, asking the right questions,
Okay.
making sure you're getting the best care.
I like that.
It's your health.
Yeah.
You deserve to be involved.
Right.
It's also about knowing that those systems are in place to protect you.
Ethically and legally.
Exactly.
Okay, so back to risk management.
Yeah.
We talked about record keeping.
Right.
What else can dentists do to avoid those lawsuits?
Well, online reputation is becoming a big one.
Oh, yeah, with all the review sites,
Exactly.
health grades, all that.
It can really affect a dentist's practice.
It's a whole other thing to think about.
It is.
So they have to be careful how they respond online,
They do.
especially with those negative reviews.
Yes. Those are tricky.
How do they deal with those without breaking the rules?
The best thing is to try and address it offline.
Directly with the patient.
Right.
But they still have to be careful about confidentiality.
Oh, absolutely.
Can't share any private info?
Nope.
Sounds like a minefield.
It can be.
That's why so many dentists are using reputation management services now.
Yeah. It's a lot to handle.
It's crazy how much technology is changing dentistry.
It really is.
Not just the tools and the techniques,
Right.
but how they interact with patients,
Yeah.
how they run their business,
It's all connected.
even how they protect themselves legally.
Everything.
It's always changing,
It is
scientifically, ethically,
always evolving.
but one thing stays the same,
What's that?
putting the patient first.
That's the most important thing.
This has been great.
It has.
So informative.
I'm glad.
We covered so much.
We did.
The ethics, the legal stuff, even how technology's changing things.
Yeah, a good overview.
But before we wrap up,
Okay.
I want to leave our listeners with something to think about.
Ooh, I like this.
We talked a lot about the dentist's responsibilities.
We did.
But what about the patient's responsibility?
That's a great point.
It goes both ways, right?
It does.
Just like dentists have ethical and legal obligations.
Yeah.
Patients have a role to play too
Absolutely.
in making sure it's a good experience.
For everyone.
What does that look like for patients?
Well, it starts with honesty,
Okay.
being upfront about your medical history,
Right.
any medications you're taking,
Okay.
even your lifestyle habits.
Yeah, like how much coffee you drink or...
Exactly.
Yeah.
It all makes a difference in your treatment.
Right, because the dentist can only work with what they know.
Exactly.
What else?
Communication is huge.
Okay.
Don't be afraid to ask questions.
Yeah.
If you don't understand something about the treatment plan or you're worried about a procedure,
Okay.
speak up.
It's your mouth.
It is your health.
Yeah, you have the right to understand what's happening
Exactly.
and to be involved.
Absolutely.
Okay, so honesty and communication,
And then there's following your dentist's instructions.
like taking your meds,
Yes, taking your medications as directed.
brushing and flossing,
Keeping up with your oral hygiene at home.
go to your checkups.
All of it. It's important.
So it's about being proactive,
Exactly.
not just showing up and opening your mouth.
Right. You're a partner in your own dental health.
I like that.
Working with your dentist to get the best results.
And just like dentists should treat patients with respect,
Absolutely.
patients should treat the dental team with respect too.
It's a two-way street.
Courtesy, consideration, all that.
Exactly.
Yeah.
Mutual respect
Uh-huh.
and open communication.
That makes sense.
That's how you get the best experience.
This deep dive has really changed how I think about dentistry.
Me too.
It's not just about fixing teeth.
It's way more than that.
It's ethics.
Yeah.
It's the law
It's a whole system.
and patient responsibility.
All of it.
I'm glad we could unpack it all.
Me too. It's been fun.
So what's the ultimate reward for everyone involved?
A healthy, happy smile.
I love it.
It's the best.
That's a perfect way to wrap up this episode of The Deep Dive.
It is.
A huge thank you to you, our listener,
Yes, thank you.
for joining us on this journey into the world of ethical and legal considerations in dentistry.
It's been a pleasure.
We hope you learned something new
And that you feel empowered.
to be an active participant in your own dental health.
Exactly.
And if this deep dive has sparked your interest in another topic
Ooh, yes.
that you'd like us to explore,
Send us your materials.
we're always up for a new challenge.
Always.
Until next time, happy diving.